What is the South Asian experience of menopause? Today, I'm speaking with Dr. Deepti Gandhi, who is also from India, as I am. Both of us are doctors here in California, and both of us are Menopause Society Certified Practitioners. Growing up in India, certainly nobody talked to me about menopause. And now that we are both in the West, it is an interesting experience for us to see, the experience of our friends, the experience of our families, the experience of all the other people that we meet from the South Asian subcontinent. And so, welcome to our conversation today. It's going to be wonderful. So, I'm so glad you're here. Welcome, Dr. Gandhi.
Thank you so much for having me. Happy to be here.
Of course, I see that you are a family physician
Yes.
and you are a Menopause Society certified practitioner, just like myself. So we have more than a couple of things in common. So
Yes.
that's great. Yes. Okay. So wonderful. I'm so glad for our conversation today. Before we get started, just tell us a little bit about you, what brought you here. You went to medical school, you decided to be a family physician, and now you're focusing on perimenopause and menopause. So tell us about your journey.
Thank you so much for having me here. Sure, I'd love to share that with everyone. So, yeah, I've been practicing for over 20 years. And, during the course of my practice, I actually came out of training after the WHI study came out, right? So it really shifted the entire landscape when it comes to hormone replacement therapy, our thoughts about it, prescribing it, and honestly, women's health in general. And so, we were told that it was dangerous and we need to basically get everyone off of it and no longer prescribe it just across the board, right? And so that was the information and that I was given, and I led with that. And so, as I went along, I started to kind of, notice, how my patients were doing. I had changed, my practices a little bit, but I consistently noticed that there was something that was happening to people, to women, as they went into, I didn't even really know perimenopause and menopause and that whole transition. And then by and by, my practice kind of became focused on women. And really, what ended up happening is about maybe 6, 7 years ago, friends, patients were really suffering, a few of them, and they just could not find any help. And I just thought, well, why is it that I don't know anything? It really got me thinking. I would send them, they would go to, endocrinologists, gynecologists. And I just kept thinking, gosh, was it just me who, really learned nothing about this? And I came to realize, wow, there's really just a lack of knowledge amongst physicians, amongst clinicians, amongst, nurses, all sorts of medical practitioners. And why is that? And I just got so curious, and I honestly felt ashamed because I could not help them. And some of them were just like, Dr. Gandhi, I know you said you don't know. Can you just please do something? And I just thought, my goodness. So I just felt really, again, I'm just gonna say ashamed, and I felt so deeply badly for them. I wasn't even there yet. And so I just kind of started doing like a deep dive. I kind of created my own little mini fellowship, reading, just devouring everything I could, right? Like articles, books, podcasts, courses. And that's what culminated into me becoming, like yourself, a Menopause Society Certified Practitioner. And a few years ago, I completely flipped my practice. So all I do is midlife women's health and hormone health, menopause, 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 day and night.
Yes, wonderful. I'm so glad because the last time I checked, the Menopause Society still had only about 3,000 practitioners in the whole country, which makes it like, I mean, one practitioner for over 100,000 women that need the help. So the need is that desperate. And yesterday I met some women at a networking event, and I found that new networks in the San Diego region, at least new networks like Sharp, is planning on opening a concierge menopause practice. And other, so and apparently Weight Watchers has announced something about they are getting into menopause care and GLP-1s and all of that. So
Yes.
I was like, okay. I mean, on one hand, this is great. This is great
Yes.
because certainly there's the awareness that women need this. Um, and something would be better than nothing, of course, right? But we
Absolutely.
really have to see what is the kind of training that is out there that all these people have. Because what I find is that there are some women to whom you can give like a moderate dose of a patch and a dose of progesterone, and they will do well enough. Okay, there is that portion of the population out there, but the women that end up finding me, and I wonder how it is for you, are ones that have, like, for instance, there is a woman that I'm working with. She is in her early 60s. She's been on HRT since she became menopausal, and she recently got diagnosed with osteoporosis. And I was like, okay, what's wrong with this picture, right?
Hmm.
She's been on the smallest dose of estrogen for the longest time, and obviously it's not helping, right? So it's more than just giving somebody a standard, whatever you think is standard prescription. It's knowing more about what's actually going to move the needle, right? So
Correct.
anyway, I'm so glad. And of course, our experience as being South Asians, and I figured that this would be an interesting and amazing topic for us to dive into. First of all, growing up in India, in my household at least, menopause, and we were an all female household. I had no brothers. My dad passed when I was really young.
Oh,
So it
sorry.
was four sisters and my mom, and nobody mentioned a word about any of this. What was your experience like about any messages you might have received around menstruation, perimenopause, or menopause as you were growing up?
Zero. So I grew up in the US, and let me tell you, Mana, for me, it was a chance hanging out. I was maybe like 8 or 9, visiting some relatives out of state, some type of family party. There was a girl who was my age that I met, and so it was like we were hanging out together, and she happened to mention that her older sister, told her that you're going to bleed from there, and it's going to be in your underwear, and it's going to happen once a month. Oh my, and we were both like, horrified. And that's all that was said. And that's all I knew. And I never saw her again. And the conversation never came up again until I woke up one day and went to the bathroom and was screamed in horror thinking I was dying. And it was that I had my period. So that's really pretty much my experience, what I was taught. So I think that all ties in, right, with, not talking about it. And then, I mean, when it came to perimenopause and menopause, it wasn't really discussed, not very much, like maybe a little bit. I noticed my mom, and I was in my training at the time, so I kind of had an idea. She was having some really bad vertiginous migraines. And so I had, figured out that there was a link there, but not much at all in terms of conversation.
Okay. It's so interesting because I would have thought, a few years ago, I would have thought that this is peculiar or particular to South Asian households. It's certainly in the West, people must talk about it. And I have been so amazed to find out that no, even in the West, no one talks about it.
Oh, I absolutely agree. I was just doing a talk for a local charity group, and it was for the mothers. It's for children, but it was for the mothers, and it was all about menopause. And there was people from all different backgrounds, and like you said, it was very similar experience.
And I really wonder about that. And I'm veering off of our planned questions for a second, only because I just feel this is so important to talk about, right?
Yeah.
In the TEDx talk that I did earlier this year, the crux of the argument that I'm making is it's time to break the silence, right? And I just feel like, why is there this huge silence? It's almost like either something is wrong or something shameful or something just so taboo that as a society we can't talk about this, right? So there are phases in women's life, right? There is puberty, of course, and of course I think in the West there is some preparation that mothers and parents will do for the children, that okay, for the girls, like, okay, you're going to go through this pretty soon. There is some a milestone celebration, something like that. Pregnancy, of course, is celebrated, right? Like there is a huge infrastructure to support pregnancy. But then again, it falls off the cliff right after for the fourth trimester, right? There's not that much support for the fourth trimester. But then when you get to perimenopause and menopause, it's like crickets, right? And what I have been so amazed at, like, what is really happening is actually ovarian failure, right? We're not saying it like that. We have this word called menopause with so much baggage, right? And anyway, I can come back to our planting, but it's just like, every woman is going to go through this, and yet we don't feel this is something to talk about.
Agreed. Well, I think, there's a lot of, social conditioning, cultural background comes into play. What we've been taught, and our subtle and sometimes not so subtle messaging from society is, a woman's worth, her power, her social currency is based in her fertility, her looks, right? Her youth, right? And so it calls a lot of that into question. I agree.
I absolutely agree. And the thing that I feel that, okay, this is how it is, and then so what? What are we going to do about it? Right? It always comes down to this is the situation, this is the system. What are we going to do about it? Right? Who makes up the
Absolutely.
society? It's us, people like us. So if we speak up and if we begin to do this, and this is a very person to person thing, like if we do more of this, if we normalize talking about this, if we refuse to give in to the thing that a woman's worth is only when she's young or fertile, I think that's absolutely nonsense. Even the young and fertile women need the support of women who are older and non-fertile, right? Like it's a whole system.
It's you're
So
absolutely correct. I will say though, I think the tide is changing. I will say Gen X, right? The oldest Gen X is turning 60 this year, right? And so we are, and I'm part of Gen X, is, you know, we're going to be the oldest people in the workplace. And we're in a unique position, right? Where, yes, we really weren't given much in terms of education on perimenopause, menopause, any of this, as you said. But, we get to be the trailblazers. We get to change things for the millennials who have entered, the transition, right? They're probably in peri, some of them at least, and Gen Z and all of the future generations. So it's like we get to be the pioneers, right? And it's a movement. You and I know because we're in the space every day that it is on fire. People are talking about it. Gen X is not taking it. They're not going to do this like our dear mothers did, and our grandmothers and all of the women before us for a variety of different reasons. It's changing.
it absolutely is. And I think a big part of it is also we have access to tools and technology that our mothers
Yes.
did not have,
Yes.
right? Women
Right.
have always tried to advocate for women. There was Our Bodies, Ourselves, and the other kinds of literature.
Right.
But, those books have always been written, but they didn't have the reach of social media from today. So I'm really glad
Absolutely.
that Gen X is taking the bull by the horns and
Yeah.
trying to make a difference. And yes, there are a lot of people talking about this, including the two of us, and
Yes.
we are doing our part here. So,
Yes.
okay, and a big portion of this is educating the men.
I really like to reframe this, right? This is a condition, this is a phase, this is a stage, whatever way you want to describe it, that human beings experience, right? Like and it's based on your biology, right? And so it's just important to know everyone knows someone who is going to go through menopause. Everyone loves someone who is going to go through menopause. Well, I'm so glad that you brought that up. I think it's really time for us to kind of, really zoom up and look at what we're talking about here, right? We are talking about an experience that human beings go through. And whether or not you biologically will go through that, you can have compassion and want to understand what that entails and what that means. Because guess what? Chances are you love someone who is going to experience menopause, right? All of us have come through a mother. We have sisters, we have friends. So it's just important. It's an experience that 51% of the population, if they stay alive long enough, will go through.
Right. And we were just also wanting to kind of tie in the whole piece with like bringing the men into the conversation and
Yes.
educating them about what this means for the women in your life, the
Yes.
women that you love, your partners, your sisters, your mothers, your daughters.
Mhm.
You know, every female in your life is going to go through this, and we it would be so great if as we are educating the women we can also educate the men because
Absolutely.
they need to understand it as much as we do because we rely on men, men rely on us. It's all like we do this together. It's not like that only women need to understand and get on with it, right? So i'm
Absolutely. Yeah, we
i'm
need
i'm
to
glad.
stop gendering conversations. We
Yeah,
need to stop calling things women talk and
yeah,
men talk. It's human being talk,
yeah,
and it's important
yeah.
to understand the plight of everyone.
I think as a society, I think we are beginning to make progress. But like I was at this networking event yesterday, and there must have been, I don't know, 200 people there. And it was not half and half. I would say it was probably 60% men and 40% women, which
Yeah,
is not bad, right? Not bad. But I still found that the men congregated with the men and the women congregated with the women. And then little by little, they would start to, interact and mingle and all of that. And I'm new to this organization. So, yesterday was my, I think, third time that I went in. And now I know a few people, so I can like kind of go ahead and feel comfortable, start conversations. But when it is like two or three, four men standing there talking, I myself have a feel like, okay, do I want to just go and introduce myself to them, or do I feel more comfortable speaking to the women that are here? And then little by little, so it's how we have grown up, how we socialize. So all of that is work in progress, right? Work in progress.
absolutely.
So, okay, so coming back to South Asian, do you find anything particular about the South Asian experience in your experience as a doctor, how they deal with menopause?
This topic is I'm so passionate about it because we don't talk about it enough, right? So thank you for asking that question. Yes, the answer is yes. So there are many symptoms that are kind of pretty common across groups for women to experience, but South Asian women have some unique experiences that we really need to highlight, right? So, South Asian women, when we talk about South Asian women, we're kind of putting in, groups of people that, live in India, Pakistan, Bangladesh. Some people include people from the Maldives, Bhutan, who live in those countries, as well as who are part of the diaspora, who may live in different countries as well, right? So we're actually trying to put all of them together. And we don't have enough research and data, but we do have some, and so yes, we tend to notice in this group that women enter menopause sooner, earlier than white women. We notice that there are more somatic complaints, definitely vasomotor symptoms. We notice genitourinary symptoms as well. But I really want to highlight the metabolic changes that happen, the changes in body composition. As a group, South Asians have the highest rate of cardiovascular disease and deaths from heart attack of any other group, right? We make up 25% of the world's population, but we have the highest rate, you know, insulin resistance and diabetes, right? It's really important that we emphasize. And, when we talk about menopause, right? So, menopause on average for South Asians is going to be a few years before the average age for white women in the West, which is kind of around 51. So, there's a range. And so the range is somewhere from, depending on what you read, somewhere between 46, 48 years old for South Asian women, right? Now, we know that perimenopause, which is the time preceding menopause. So menopause, just quick little definitions in case, someone isn't in this space like you and I all day and night. It means that you have not had one single drop of blood, any type of period bleeding for 12 months. Okay? So we kind of think about it like your ovaries have retired, right? They are done. Now, if you've gone through surgical menopause, that's a different story. So you might have a different journey with that. Okay. Perimenopausal symptoms can start up to 10 years before, on average, 4 to 10 years before, right? So that means that you could start having some subtle changes, some changes that are gradually increasing, that you're blaming on stress or the kids or work or whatever, that are actually related to hormonal shifts in your 30s. So it's just really important to think about that. And I don't know if we talk about that enough, right? And among South Asians, like you said, if we barely talk about menstruation, even what to expect, how can we be talking about menopause and what to expect? And this is a major metabolic shift that is now going to impact you for the rest of your life.
I absolutely agree. And I think, you know, like I never thought about it as growing up, but like when we were kids, all the grown-ups, all the ladies, all the aunties, nobody was fit, right? Nobody had a
Mm,
waist. They were all like either straight or like
mm-hmm,
pear shaped or like apple shaped.
mm-hmm,
And like, I never gave it a thought growing up, but as I began to get older, and I was like, is that my future? And I would
mm,
hate that because I don't want that for myself. So it's like being cognizant of what the body composition changes look like in our particular heritage and the effort that we need to take. And I think it's also our diet and lifestyle, right?
absolutely.
Our diet and lifestyle is not healthy. And I'm so surprised because we come from the land of Ayurveda, which talks about like, this Agni and that, and eat this with that, and so nutritious and helpful and all that. But I don't think we bring in the lifestyle component as much. And I think we've forgotten all about these we eat whatever we eat for comfort, and our food is carb heavy, right?
Yes.
So all these things combine to make that body change that comes in as you get into your 40s and 50s. And I just want to say, like, how do you advise a woman who's coming to you in her 40s and wants to maintain her body shape as she has had in her 20s and 30s? What advice would you give to her, keeping in mind our metabolic disease
Yeah.
burden, keeping in mind our highest rates of cardiovascular disease? What advice would you give them?
Well, that's a great question. I want to kind of back up a little bit to something that you were talking about in the beginning, which was our diets, right? And kind of, the genetics that we tend to carry as South Asians. But I want to point out something. There's actually a book that I'm reading by a colleague. It's fascinating, and it's by Dr. Mubin Sayed, which you might want to have him as a guest. He's amazing. And it really talks about our history of South Asians, of like, how did we get here? Like, why do we have a higher body composition when it comes to body composition percentage of fat? And why is our muscle mass lower when we are compared to other groups of people? And a lot of it has to do with our biological adaptations to colonialism, to starvation from the famines. It has been extremely impactful. It even impacted what and how we ate, our diets. We see that we have so many flatbreads, right? And we think, okay, well, that's all carb heavy. And then the white rice, right? And then you'll have like a side dish, maybe some sabji or shak, depending on what you call it. That's going to be very potato based. It wasn't always like that, right? We didn't just simply use wheat and white rice as the main things that filled our plate. That wasn't the case. Many generations ago, before the colonization, were actually eating complex grains things that had more protein, that had fiber, and had a lot higher nutritional content. So it's really important to bring that piece up that I don't think we talk about enough.
Mm.
Yeah.
Yeah, I'm so glad you brought this up. I will definitely
Yes.
look up that book.
Yeah.
That is certainly there. I mean, we know we here in the West, of course, we talk about the Black experience and how
Absolutely.
hypertension is higher. And to me, of course, that makes all the sense because, right, epigenetically and
Absolutely.
genetically,
Yeah.
we internalize the stress, and
Right.
then those habits over generations they continue, so they foster. And then again, I think a really important thing is to kind of just pause at this point and kind of see what is going on and see what changes we need to make. What
Absolutely.
right. And
Absolutely.
we
So
can
I think
start
I just,
small. Yeah.
yeah, no, I'm sorry, I didn't mean to interrupt you, but no, I absolutely agree with you. And I think it's important to understand why the baseline is what it is. I think what I'm really feeling in my practice is that getting a baseline body composition testing is really valuable just to know where you're at because when menopause comes, right, that causes a profound shift in all women, right? So what's happening in menopause is our subcutaneous fat, right, is expanding. The visceral fat, which we can't see, right, which is that intra-abdominal fat, that is increasing across the board, right? Muscle mass is going down, bone mass is going down. So what's effectively happening is your risk of osteoporosis is going up, right? Which is the thinning of your bones. You don't really have symptoms, but you can easily fracture yourself. 1 in 2 women who are postmenopausal or who are not on hormone therapy will have an osteoporosis related hip fracture in the US, right? That's a statistic for all women in the US only, not specifically South Asians. So it's really important. Cardiovascular disease goes up, right? You and I know insulin resistance goes up because our estrogen levels are going down, right? So the risk of diabetes is going up, right? So it's really important to look at all that. And so the body is kind of adjusting. It's making more cholesterol, thinking that through a couple different enzymatic reactions we can eke out and make some estrogen, and the fat is increasing, and we know it coming right to the midsection, which is that meno belly that everybody dislikes, right? And people even feel like even if they don't notice like weight changes on the scale, they notice like, hey, my clothes are fitting differently, like how is this sticking out, right? And it's more than vanity. It is a change that you're noticing in your body. There's a lot of meaning underneath that change, right? So that fat is increasing because we can make some estrogen in our fat tissue, right? Is it efficient? Do we like it? Absolutely not. No, we don't. But I think it also brings up a few things: your relationship to food, your relationship to movement and exercise. Was it to be skinny? Was it because you thought you ate badly, right? Like all of this comes up during this time. I just think specifically for South Asians, it's really important to understand that it's not about, just grinning and bearing it through some really bad hot flashes. No one's giving you a medal for that, number one, right? Number two, these symptoms are indicating of a lot more that's going on a cellular level that is going to impact your health in the long run.
Yes, absolutely. And we'll come back to, the advice that we want to give to women in general and South Asian women in particular in a bit. The experience that I've had with South Asian women and menopause, and I don't see that many South Asians in my practice for some reason. What I find is that I have friends, of course, who are South Asian, who are going through menopause, not on hormones. And I ask them, like, why aren't you? And I find a very peculiar resistance, you know? And some of them are physicians.
Mm-hmm.
Okay. And there is this peculiar resistance, and I'm just like trying to understand what in the world is going on in their heads. These are intelligent women. Okay. So part of it is, oh, I want to be natural.
Mm.
Okay. That's one.
Mm-hmm.
And the other is like, oh, I just don't know. Do I want to? I'm like, oh my gosh. I mean, how do
I
you
love
deal
it.
with that?
I totally feel you. I totally feel you right now. I love Yes, that is, I've seen that. I've experienced that as well. It just, I love the reenactment that you did. And I love to laugh. So finding humor is always important. I agree with you. There is a resistance. And, I've often really tried to think about, there's like this brittle nature to it, right? And you and I know clinicians can be very, very rigid in our thinking. We need to see a lot of proof, and even when you show the proof, we need to see more than that, and so it can take some time. I think there's the fear, right? All the WHI, right? It's just still pervasive, and it's really hard to sometimes undo that. I think also we don't have models, right? We don't have role models, is what I mean. The generations prior to us, right? They had a very different journey than us. Maybe, for some of us, they immigrated, right? So they had that whole experience. Some did not. But absolutely, when you look at South Asians on the whole, whether we look at South Asians that are part of the diaspora or live in South Asian countries, the statistics and numbers are very low when it comes to who is seeking out care, help, education, potentially therapy regarding this. And I think some of this comes down to the mentality that is looked at when we think about menopause, right? Like for South Asians, typically, not everybody, in South Asian countries, it's looked at as a positive or neutral time, right? Whereas sort of in the West, it's a little bit more negative, the loss of youth, the loss of fertility. And I think that some of that really comes from period shaming, right? And just all of the things that, specifically in some South Asian countries and cultures, people go through. You can't really talk about periods. It's hard to obtain, sanitary products. It's hard to obtain enough products. How do you dispose of the products? I mean, there's so much to it. And I don't want to pretend to be an expert because I don't live in those countries and I have not grown up in those environments. But from what I have read and heard about and, people have shared with me, it's really difficult. And then I also think that not everyone is connecting the dots in terms of like their symptoms. And this is menopause related. This is a hormonal change. This is a metabolic change. Like, I don't know that we're connecting all of those dots together.
Yeah. So, do you have a sense of how we might help the South Asian women understand menopause better so they can make more informed choices? So, if a woman kind of considered everything that's available on hormone therapy and menopause and all of that and did a risk benefit analysis for herself, and then she came back and said that, I studied the whole thing,
Mhm.
I don't want to do it for XYZ reason. That makes complete sense. Okay. I mean, every woman has the right prerogative to make her choice herself. But my thing is just like, but have you looked at it? So that's always like my big concern is like, are you sure you have looked at the right information? Because there's also wrong information, right?
Oh, absolutely. You're absolutely right. I mean, and I think it's really the fault of, the medical industry, right? Like we haven't educated ourselves enough, right? Still to this day, right? In medical schools and residencies still, right? So,
Right.
that there's that. And then therefore we haven't educated our patients and women especially, right? So that's a big problem. But I think, you and I talking about this, getting loud about it, and I'm glad you brought this up because some dear colleagues and I are actually, trying to organize a menopause summit for Black and Brown women, right? So it's about getting into our communities and bringing it up. It might be uncomfortable, but just putting it out there because there's people that need to know. And then like you said, if you have the right science-backed information, you get to make your well-informed
You
decision
get
for
to make your choice.
yourself.
Yes,
Exactly.
you
It's
get to
your
make your choice.
choice what you want to
Right.
do about it.
Right. Okay. So here's another thing which I find I wonder what the South Asian experience is when it comes to sexuality and the genitourinary syndrome of menopause. What is your experience? Do women come seeking help for that?
Sometimes do, sometimes they don't. Again, I don't know if they put it all together, but when you look at the amounts of money that people are spending on going through all sorts of lubricants and thinking, oh, that's the problem. Let me try another brand. And again, in these cultures, typically talking about sex, intimacy, sexuality, it's somewhat taboo. There's some silence, there's some shame, there's a lot of reasons behind that. So, going to your doctor and bringing this up, is not something that many South Asians, not everybody, but may initially be very comfortable about, right? So it's something that as clinicians, we need to ask, we need to dig, right? And I'm telling you, like I was saying, I mean, the amount of money and time people spend online privately looking at things, ordering things from Amazon, trying all sorts of things. If only we could say, hey, why don't we have you try a tube of vaginal estradiol cream? It's pretty safe for just about everyone. And it's much cheaper.
Yeah, yeah, and for me, it's like always okay, so on my YouTube channel, that's the whole point of it, to educate women, right? To educate women about what to expect. People don't even know what to expect, like as they go into a 40s, because so much is happening in our lives, right? We're taking care of parents, we're taking care of children, we're taking care of relationships and careers and all of that. So the fact that we are tired and stressed and not sleeping well, we just attribute it to all that.
Absolutely. I'm so glad you brought that up, right? Like midlife is no joke, right? And so midlife is happening. You're squeezed between different generations. If you have kids, you're raising them. Some people have grandkids even. You worry about your elders and their health. And as women, we are just kind of multitasking machines. We're biologically primed, we're socially conditioned to be that way. Multiple tabs are open, we're enmeshed in everything. And that's why, these symptoms happen and people feel like they're short circuiting. They're like, I have brain fog. Oh my gosh, I shouldn't be working anymore. I'm making these decisions. I can't remember things anymore. Or, you're not sleeping. I mean, forget your libido just from that. Right? And then all these other strange symptoms are happening. So it's just a challenging time as it is. And then, menopause is here or perimenopause. And so it really can make you stop in your tracks. And that's why I like to kind of reframe that. Like, this is an opportunity to really shine that light that you shine on everyone else and on yourself, to pause, to get off the hamster wheel. Because let me tell you, women, oh my goodness, if the hamster wheel broke, we would just find another one, a new shiny hamster wheel, and get growing and rolling on that, right? That's just how it is. I'm not saying it's right. I'm not saying it should be that way. But for many, many women, it is that way. In fact, women are the medical decision makers, right? In their family of origin, in their immediate family. They talk about it at work, right? Like, so they are in everything, So it's just, again, it's an opportunity to pause, to prioritize yourself, to reassess your health, your goals, your dreams.
I think what I have found is that there is a strange disconnect that some women have when it comes to their own selves, their bodies, their well being. Part of it is just like this Sati Savitri, like taking care of the family, taking care of, oh, my children, let me take care of my son, let me take care of my grandkids, or like I'm getting old, this is part of aging. And it's like, yes, of course we are aging and we will age despite, even if we do HRT, we are going to age, but we can age better. We can age with ease. We can age with comfort. And it's just like gets me, there's all these women, right? Like especially if you go to, I don't know, like the biggest bolus of South Asian women that I get is when I go to the Gurdwara. And it's like
Mm.
all these women, and they are walking funny because their joints are hurting and they're in their 50s. They can't get up without support from the floor. I'm like, please, there is help and it's not expensive and it's not invasive and you can do it. It's like, I don't know. I don't know how to tell them, you know?
I hear you. I see this as well. I think you're right. That sort of martyr kind of mentality. I think that is what has been modeled to us. It was literally in generations, older than us, they've been programmed to be that way. And that's how you are a good wife and a good mother and a good partner and a good daughter and, you name it, right? All of those labels and roles. And I think what happens is so much of the purpose and is kind of related to all of that when you no longer, the kids have grown up, maybe you're not needed, to that level, right? Needed, right? It's a big shift. It can be depressing. I didn't share earlier that mood symptoms are also experienced by all women going through this, but definitely in South Asian women, right? And they don't necessarily connect the dots. And reclaiming your purpose, that your purpose isn't to serve everyone else, right? And I'm not saying this is how all women, have been taught and lived in the South Asian communities, but that is a predominant kind of way of being, way of living that, I think many of us see, right? And that's what's been showcased to us to some degree. And I also wanted to touch on something you said, that it's being on, if someone decides to be on HRT, on menopausal hormone therapy, it definitely will help your symptoms, right? It is the gold standard when it comes to hot flashes and night sweats, and it's the only FDA approved medication to prevent osteoporosis. We don't have any other medications. But people don't talk about the impact of having brain fog, of having crippling anxiety, of having depression, of having awful sleep, how that impacts the rest of your health. We talked about the metabolic changes that are happening, but we also know from research that when HRT is started within 10 years of your last period and before the age of 60, and that's not, final, right? We can talk about people who fall outside of those ranges as well. It decreases your chance of developing cardiovascular disease, of dying of a heart attack, of developing osteoporosis, of developing diabetes, even colorectal cancer. So
Yes.
there's a lot to it, but you're right, that piece, about being a martyr and pushing through it, we need to pay attention to that. We need to talk more about that.
Okay, so let's do this for a second. Let's say you are speaking to a large audience of South Asian women and you are going to tell them what to expect during perimenopause. What symptoms will tell you you're coming to perimenopause and menopause, and what they should consider when they're trying to see how to go through this phase of life being the most vital that they can be.
So what's happening in perimenopause is your ovaries are producing hormones that your body was used to having ever since you first had your period when you were a tween or a teen, erratically, right? So some days you're really high, some days you're like crashing low, and that's what makes the symptoms so challenging. Every single cell in your body has, for example, an estrogen receptor. So every single cell will be affected, right? And so that's why if we go from head to toe, for example, you start noticing changes in your hair texture, skin is changing, brain fog. People talk about having tinnitus. They notice their mouth is dry. They notice they're more irritable, kind of maybe those like sort of, PMS symptoms are kind of exaggerated more, right? Their periods may or may not change. They might just keep having regular periods all throughout this process, or they might come closer together, right? So there may or may not be change, because a lot of the time I think people focus, but I still have my period, but I still have my period. Doesn't matter. That's kind of almost irrelevant. It's all the other symptoms, right? So we talk about, memory, recall, just feeling not as sharp as you were, being just fatigued, exhausted, sleep quality is suffering, feeling hotter, sometimes feeling cold. I've had people have cold flashes too, right? So I want to bring up weird symptoms, right? Rage is a big one, while you're cooking dinner or doing all these things, or feeling like other people aren't, carrying their weight, right? And that elasticity is not there that you had, right? Which also brings into question the chore wheel. So, like, what role are you playing in enabling, right, everyone else in the family? Maybe they can start doing things themselves. But going on random joint pains, muscle pains that are out of proportion to your activity, that don't make sense. Okay. We talked about, starting to put on weight, and, the usual things, the usual often healthy things not seeming to work. It's the fat distribution, feeling like that's changing. It's all right here in the belly. Okay. Feeling, like you're sweating more, you smell differently. That's a big one that people talk to me about. Palpitations that make no sense, that you've had worked up and no one can figure it out. Everything's normal. Some other ones we'll talk, of course, about hot flashes, night sweats, and I think those are the big ones. I tried to throw in some strange ones. Hair thinning, hair loss, right? Random itching. I've had patients who are like, I just itch all over and I don't know why. And I've eradicated this from my diet and that from my diet. And I went to the allergist and now I'm going to get a biopsy. And it's like, it could just be decreased estrogen levels. I've seen that happen too. I don't know if you want to throw some in there. There are at least 34 symptoms, but we're at maybe even more.
Yeah, I think the other ones important to mention are the urinary symptoms, right?
Yes, let's get to
Frequency.
that. Yes.
Yes, frequency, urgency, just
Nocturia.
frequent UTIs, right? Frequent
Yes.
UTIs are a thing. Of course, we already talked about the vaginal itching, burning, all of those
Yes,
symptoms.
dryness, pain with intercourse. Absolutely. Such an important, the genitourinary syndrome of menopause is what we call it now. So important to talk about those. And you may not put them together. You might think, oh, I feel weird down there. Is it, like you said, is it a UTI? Well, I don't know. I grew something out. I took an antibiotic, but I don't know. I don't feel any better. Maybe it's a yeast infection. I tried this. I don't really have a discharge. All of these
Yes.
just
So all of these
strange
symptoms are there.
changes. Yes.
So, okay, so now a woman has kind of understood, oh, these are all connected to perimenopause and menopause. What am I going to do about it? How should she begin to think about how to bring a sense of normalcy into her life?
Absolutely. So, I think the way to think about it is, I always tell people journal, right? It's really important. Keep track of what's going on with your symptoms, your cycles. What are you noticing? And as long as they understand too the impact on the rest of their health, their life, I think it would be really great to start educating yourself, reading books, listening to podcasts, following accounts that are science based, right? And then if you feel like you may want to consider treatments, there's non-hormonal, there's hormonal. It takes a whole toolkit, right? We don't want to minimize this. And I know you agree with me by saying, oh, you're just going to slap on an estrogen patch and take some progesterone and you'll be good to go. Just continue as always. No, this is a profound shift in your life, in your health moving forward. Like I said, it's not all doom and gloom. It's an opportunity to really take care of yourself. You're kind of changing what I tell my patients in my practice into version 2.0 of yourself, right? When you entered, puberty, it was a major shift. You were growing hair and growing parts and, smelling and, all sorts of crazy things were happening that you felt like you didn't have control over. You're an adult now. You have some control over this. you get to decide what you're going to do about it, right? And so hormones might be one of the tools in your toolkit, but really working with an experienced clinician, right, would be very important. Like you said, finding someone maybe that's a Menopause Society certified practitioner. Does that guarantee you're going to love them and they're going to be the right fit for you? Well, of course not. But at least it's a place to start, right? And then, considering like, what supplements do I need? Do I need supplements? Where does that come into play? Your nutrition, sleep hygiene becomes a non-negotiable, right? You can't just throw yourself in, to sleep after you watched the scary nightly news and some, serial on Netflix that with zombies in it and expect to sleep well, right? Like it's hard to come by, right? You know, you're looking at your relationships. Do they serve you? We talked about how important it is for everybody to have some education, right? Your partners, your children, if you have children, your coworkers, right? Like you and I talked about, talking about this in the C-suite, right? This is impacting us everywhere. And if you work or live with women going through menopause, you're going to be impacted too. So we all need to learn about it, right? So creating your kit, I think, is really important, and the tools that work for you.
Right. Right. And I would just say that in addition to being aware of what symptoms you're experiencing and keeping a journal so you can tabulate, you can kind of see, you can keep a finger on the pulse of how your body is telling you all these different things, and then evaluating what are the different therapies that are out there that could help you, and working with a practitioner, a hormone literate practitioner who knows about the nuances of the different kinds of options that are out there for you, starting from, of course, diet and lifestyle on all those factors, but also what kind of supplements might help you, what kind of hormone therapy is out there and would be a good fit for you, and be able to work with you, with your body, to get you to a level where you feel your best, right? And where you are preventing osteoporosis, you're preventing cardiovascular disease, you're preventing metabolic disease, and giving yourself the best chance of aging in as healthy and vital a manner as possible. So I think it is so important to know that these changes, they are normal and natural, but we can do something about them. And a lot of these hormones, thinking back to what my original impression, my original reaction was to the word hormone, it wasn't positive. It was a negative thing. And yet, at the time of the WHI, I wasn't in the medical field. I had a completely different profession. So the whole WHI, I didn't even notice because, I was young. I didn't even have kids at the time. So, it wasn't part of my consciousness, but somehow the word hormone was scary, right? And it was scary not because of WHI, but because of the doping scandals, right? We had heard about the growth hormone or these steroids hormones that athletes took to get some illegal advantage. So that was my impression. That was, well, I think examining if you have resistance to hormones, examining where is it coming from? Is it helpful to you to have that resistance? Will it keep you from doing the due diligence on this therapy, which I feel certainly, I tried the supplements when I was perimenopausal. I tried a few different supplements. It did not a thing for me. For me, right? For some women, they are very effective, right? So, kind of like being open and willing to try different things, right? And kind of seeing what is the best thing for you. And your needs will change as you get deeper towards menopause and after menopause. Okay. So two things that I want to get to before we sign off today is one, what are all the ways that you help people? Help women, right? Because I know you are more than just a menopause doctor. You also have another very important piece of work that you do. So I'd love for you to talk about that, where people can find you, and any parting words of wisdom for the South Asian posse.
Oh my goodness. Thank you so much. It's just been fantastic having this conversation with you and being part of a change, right? In this time in women's health and in South Asian health. right?
Right.
And I love what you said about really just being open to change, advocating for yourself. So, in terms of where to find me, so I'm on Instagram as Dr. Gandhi underscore MD. I'm on TikTok, Dr. Gandhi MD. And I have my private practice where I am a midlife women's health and hormone specialist. I also work for a company called My Alloy. And I also offer coaching, so personal development coaching. I also teach medical students all about, really their own personal development, their own journeys, avoiding burnout, mindfulness, a lot of different topics. I'm a speaker. I get hired to also teach and talk about menopause, of course, for companies. So thank you. Yes, I wear a few different hats and enjoy them all. I'm a mom. I'm a dog mom. So all of those things give me joy. And I'm a perimenopausal woman myself, and I'm South Asian. And I'm here with you, with all of us together. So I understand and I have compassion for our journeys together. And each one of us, we're putting us all into a category. There is a lot of things that we have in common, but we all have our unique journey. So it's really important to consider that. I guess my advice is to be choosy and really curate your life. That is what I keep coming back to whenever anyone asks me for parting words. And when I say that, I mean everything that enters your body that you ingest. So not just food, what you listen to, what you consume on your phone, what you talk about with people, what you read about. You are worth it. You deserve to enter this phase and really reclaim your passion, your purpose, the way you want your health span to go, right? We're staying alive, at least in the US. Collectively, US women are average, age is, our life expectancy is 81, right? And so if you sort of enter full menopause by your late 40s or early 50s, that's a good 3-4 decades to go, even maybe more if you're lucky. What do you want to do with this time? You get to really look at this as a blueprint and co-create it, So to me, again, I go back to being choosy and prioritizing yourself.
That sounds wonderful. Thank you so much, Dr. Gandhi. I am so
Pleasure.
appreciative we could have this conversation today.
Yes.
And I look forward to our continued collaboration further down the road as well.
Absolutely. Such a pleasure. I am so grateful to be here, and I love what you're doing in terms of moving the needle for South Asian women. So needed. Thank you so much for all of the work that you do. Really appreciate it.
Thank you. Yes, thank you.